Hi, everyone. Welcome to this inaugural Q&A from the Washington Post about the coronavirus or COVID-19. I'm Libby Casey, anchor at the Washington Post for politics and accountability. And as you can probably tell, I'm broadcasting from my living room right here in Washington, D.C., because like all the rest of you, we are trying to limit our contact in the newsroom and practice social distancing. Well, over the next hour, we'll answer your questions, and I have some great guests that'll be joining me to do that. And they'll start coming into the conversation in just a moment. We're going to tap into the expertise of our Washington Post newsroom with a health policy reporter, a congressional reporter who's been on Capitol Hill watching all of the legislation attempts unfold. And we'll also talk with an epidemiologist. So if you have questions for them, you can go into chat on YouTube if you're watching on YouTube. And if you're watching on our Washington Post website, look for that submission form that's linked and you can ask questions there. And I see we have Yasmin Abutaleb with us. Yasmin, thank you so much for joining us. Health policy reporter, we so appreciate you taking time out of your busy schedule to talk with us.
Yeah, thanks for having me.
Yeah, Yasmin, we also have Dr. Giovanni Filardo, an epidemiologist, getting his shot set up. Dr. Filardo, thank you so much for joining us, epidemiologist and clinical professor at Baylor University. So you're joining us from Texas, correct, Dr. Filardo?
Yes, that's correct. Thank you for having me.
Yeah, thank you for joining us. So Yasmin, I want to start with you. The big headlines are today, they continue to just be shocking. And for people like Dr. Filardo, and even for you, Yasmin, perhaps they're not so shocking because you've been seeing this unfold and build. But one of the big headlines from today is seeing the death toll in Italy surpass that of China. So Italy now has the most deaths, and it's the hardest hit nation so far. What have you been watching unfold in Italy, Yasmin?
So I think in the US, there's been a lot of interest in seeing how the curve has sort of played out in Italy, because a lot of experts are saying, we're about 2 weeks behind Italy. So, wondering if the US is going to see a sort of similar spike in cases and deaths just a couple weeks behind Italy, whether the country is eventually going to have to take the drastic measures that Italy had to take to try to stem the outbreak. So I think, from the US perspective, what we're waiting to see is whether the sort of drastic social distancing measures that a lot of people and states have been willing to take help mitigate the spread so that we don't ever reach the crisis point of Italy. And the other thing that we're keeping a close eye on and trying to report out is whether hospitals have the protective equipment they need, whether they have the medical equipment they need, like ventilators. There's been a lot of concern over shortages of protective equipment. Our colleagues did a story about that today, about how people are nurses and doctors and people on the front line are having to make sort of makeshift masks out of bandanas and sort of come up with their own personal protective equipment because there's been a shortage. And you saw in the press briefing today, there were a lot of questions that came up about, and we've seen it over the last few days, a lot of questions over whether the US has enough ventilators, when hospitals start seeing a surge in patients. It's still a bit unclear how the the healthcare system is going to be able to handle the crush of patients that a lot of people are expecting to see.
Flatten the curve is something that we've all learned about. I think a lot of us who aren't in the data field hadn't really thought about this or heard about this a lot before. Dr. Filardo, what is the importance of flattening the curve, and what are you looking to for models of success and then models of failure, frankly?
Well, it's critical because the main issue is the health resources that we have right now. So the problem that's like we were mentioning earlier, we don't really have enough respirator or ventilator, ICU units. Therefore, the idea is to try to mitigate the curve in a way that we are actually impacting the hospital, the healthcare systems in a slower way. In other words, the idea is to try to avoid what actually, unfortunately, is happening right now in Italy, where they are getting overwhelmed. I'm a huge supporter of, as an epidemiologist, the way I see an epidemic is really based on mathematical models. To me, is what is the impact of one person over the rest of the community. So each of us, if you have poverty on the virus, unfortunately, we are going to infect at least 3 people, anywhere between 2.5 and 3.5 people. The issue is how we try to remove that number to actually gradually be lower. If you're able to bring the number around 1, we are very close to kind of stop the epidemic. So that's why the social responsibility in terms of actually keeping the distance from other people. So the social distance is very critical. So the idea is really, we started a bit late in terms of testing, but now the responsibility is on the citizen. So we are responsible, if we had the opportunity to really slow down the infection rate and therefore ultimately be successful. So forget about what happened in the past, think about the future, and try to really be, it's us, it's on us. We are we the people. So we are all here in this thing together. So we can really, really, really do it. But we need to be very, very smart. So if we want to see grandma and I have my children, let's don't do that because the children they might be carriers, they're asymptomatic. Grandma, unfortunately, is very vulnerable. So I want to have a drink with my friend. Forget about for the next 4 or 5 weeks. I want to have people over. Don't do that. I'm Italian. I cook. So I like to have people over for dinner. So I don't do that. So it's really now, it's the game is shift from the responsibility from the institution. Now it's the personal responsibility. We need to really make sure that every single citizen, every single person living in the country need to understand that it's on us. I say we can do it together.
Yeah, for both of you, story in the Washington Post today looks at Singapore, Hong Kong, different places, and points out that Hong Kong, some of those places were faster to respond in part because they've dealt with virus issues before, but that there's also state control that's been in play, but also personal responsibility. And the article talked about specifically in Hong Kong, people taking personal responsibility and taking the direction seriously. So let's go over, Yasmin, what the federal government has said about what people should be doing. And then we'll talk with Dr. Filardo about what he thinks we should all be doing.
So you've seen in the press briefings over the last few days, the president and other top officials have said, don't have gatherings of more than 10 people, to really limit social gatherings. There were some pictures over the weekend of, large crowds of people at beaches or lined up at bars. There's been a lot of sort of urging of young people, especially to please stay home, to please practice social distancing, because even though they may be at lower risk of the sort of symptoms and the effects of the virus, they can still be carriers to more vulnerable populations. So, and you saw it in the press briefing today, Dr. Birx, the White House response coordinators, sort of pleaded with young people and applauded the measures that people have taken, but also said, please stay home, please take this seriously. Even if you're not at high risk or you're not particularly worried about yourself, you could still affect more vulnerable populations. So they really sort of strengthened their message over the last couple of weeks, telling people to take these measures, trying to explain how serious this is, and just how important it is that people, not gather in large groups for a while. You saw even the president change his tone very much earlier in the week where he said, this could last till July or August. So sort of, giving Americans a sense of how bad it could get, and why the social distancing practices we're all doing now are so important.
And Dr. Filardo, would you add anything to that? I mean, even gatherings of 10 people seem like something that could easily, spiral, because if the 3 of us get together, that's fine. But then if Yasmin goes and hangs out with 9 of her friends and I go hang out with 9 of my people, then essentially Yasmin is in contact with all those people that I hang out, and so on and so forth. So what is your guidance?
You're correct. So the number of people that we think is okay to hang out with or to spend time with is based on the assumption that we know what the infection rate is in the country. So if the infection rate, let's say, is 20,000 people, 30, let me say number of people, which is more easy for the public. If you have 20,000 people, I have certain probability to have one person with the condition, with the be positive at the gathering of 10 people. So with 10 people, probably assuming there are only 5,000 people infected, probably more likely that person you don't have anybody infected. The problem we have here is that we do not know how many people are infected. So the reality is, in a very conservative terms, if you really want to beat this virus, my suggestion is really to avoid completely to actually get with your friend or family. I was invited to a birthday party, next week. I'm not going. My wife is not going. I talked to my friend, said, do not have the party. He canceled the party. So right now, the reality is we do not have the numbers. Therefore, the number of 10, it's not necessarily a number that is really real in real life, because we don't really know how many people have been infected.
We have a question that came in from Jim in California. How many people in the US have been tested for COVID-19? Yasmin, can you shed some light onto where the testing process is at right now, because we do hear one message from the briefings that the president is conducting and Vice President Pence and his team, and then we're hearing something different from other federal health authorities and people at the state level and local level.
So I don't know the exact number of people that have been tested. It's actually kind of a difficult number to get a hold of right now. There isn't a central repository quite yet of the number of cases and the number of people who have been tested. We do know that the testing capacity has ramped up, as the administration has allowed academic labs and hospital labs and other companies to get involved. They've approved new diagnostic tests from these manufacturers. So the testing capacity has increased. Dr. Flato, please correct me if there is an exact number that I don't know of. But the administration has said how many test kits are available, but that is not the same as the number of people who have been tested.
You're correct. What I do, in the past, I'm an epidemiologist. Unfortunately, that's what I do for a living. I check this kind of stuff. So if you go to the CDC webpage, there is a page where they tell you how many people have been tested according to them. I'm talking about people, not tests. So as of now, I was just checking while you were talking, they reported 33,340 people have been tested. I can even tell you how many of these people that were actually positive, but I need a couple of seconds. Yes, the problem is that now, fortunately, actually, with the regular labs or the industrial lab, the lab that we use when we go to get our blood works done, this test will probably go up awfully. So 33,000 seems very low. But I do know, as a fact, that, for example, the US asked help from Italy, and the military in Italy, they sent a bunch of tests here. I don't want to disclose more than information because I need to double check that. And we're talking about around hundreds of thousands of tests be sent over to the US. Why there was a delay, I don't know. I think that's I do know that the Chinese government, as soon as they were able to get the genome sequencing of the virus, they immediately informed the WHO. So if you are in charge of taking care of your people in your country, the first thing you do, you go to the WHO, public officials, and get the genome sequencing, and then at that point you can test. You can put together your own test, which clearly here has some issues because the CDC had a very low volume of tests available to start with.
And I think,
go ahead, Yasmin.
I just wanted to add one thing. Dr. Flardo mentioned the CDC saying about 33,000 tests have been conducted. One of the big concerns, a common point of comparison is South Korea, which was testing about 10,000 people a day. And that was a big part of how they were able to get a handle on the outbreak. So 33,000, whether maybe it's a little bit of an undercount because, they have to wait for data to come in from the states about how many tests they've conducted. But either way, that's a pretty low number, especially given how far the US is into its outbreak.
Yeah, if I can interject, actually, again, I like numbers. Out of, the US basically, compared to other country, really last among the last in terms of performing tests over 1 million people, over 1,000 people. Keep in mind that right now, I believe in South Korea, they tested over 220,000 people, but their population is way smaller than the US. The US, we're 350 million people. So if you do the math, you see how many people you have actually tested by 10,000 people, which is very low. The problem here is twofold. One is the surveillance piece, because this virus is very particular. It's very different than what we saw in the past. People that get sick, but they're asymptomatic. So if I don't test, I do not know if I do have the test, I do have the virus, and I walk around like I do not have. So without having that surveillance piece, what we're doing now, we're trying to test only the people that are symptomatic. We don't really have the full picture. So it's very difficult to really implement measure to try to actually block the whole process. The only one is a draconian process, which is unfortunately, we need to stay home.
Yeah, I mean, staying home, people have talked about how really that's relatively easy in terms of what is being asked of you. And yet it's so contrary to what we're all used to. And I'm seeing so many people do this like, oh, but I'm staying home except for, oh, but I'm staying home except for this or except for that. We will actually talk later on in this hour about some strategies for trying to adhere to all of this and you need to stay home. But I want to ask you guys some more of the medical questions and the policy questions that are coming in. One question comes from North Carolina. Rosna writes in and asks, how many have recovered from coronavirus and how did they recover? So Dr. Falardo, can you give us a sense of what does it mean to recover? Now, we know there's a severity of symptoms. So what does it mean to recover for someone?
Okay, so the first thing I want to say that people get infected at equal rate at any age. So if you're 5 years old, you have the same probability to get positive than at 90 years old. The difference is how we react. That's what I want to make sure that people understand that. It's not that everybody gets infected at the same rate. Everybody doesn't get infected at the same rate. So,
and Dr. Florida, let me interrupt you there. So that's important for two reasons. One, children can be carriers. Correct. Young people can be carriers, even if they're not reacting as severely to the symptoms, which is very important. But also, it reveals a lot about the numbers and about who might be more vulnerable and who might not be. So please continue.
Yes. So basically, the big issue here is how do we implement measures to limit the probability that the seeker, the people that have immunodepression, people that have diabetes, people that are smokers, people that are also, I've actually wrote a couple of notes here, also men that are more likely to have actually issued than women in terms of being healed. So here you have a situation where country like Italy, where we have Italy is the second country in the world for elderly. The way that Italy was impacted compared to South Korea, 80% of the people in South Korea that they were testing positive, they were younger than 60 years old. In Italy, the other way around. That's because they did a lot of testing. So when we went to see what happened in Italy, why the mortality is so high, is because the mortality in Italy is so high because there are a lot of people with a lot of issues and the population is very old. The combination of these two things just completely exploded all the numbers everywhere. What will happen here? I don't know. The way that the pattern of the population in the US is a little bit different, but we don't know what the real infection rate is, so we don't really know. We don't really have an answer.
So this question of how do they recover, can you take us through if someone does have a severe case of coronavirus, of COVID-19, how does their body recover?
So the way it works, unfortunately, let me tell you actually how you get sick, what happened to you. So the people that have this condition, they will unfortunately start to develop their body start to react. They are immunodepressed. Their body start to react with some inflammation rate, which would go very, very high. So the brain, the heart, all the organs start to really overreact to the virus getting in. And at that point, organ one by one, they're shutting down. The main problem that we have are clearly the lungs because the people cannot breathe. How they get better? Right now, they're doing a mix of. I read today actually on one of the scientific journals that they're using actually stem cells. So they get their own cells, they try to elaborate, put it back into the body, and the body's trying to react. How do we know if the person is actually sick or not? What we do one test, and then after 2 days, after 24 hours, we do another test. If the two tests are negative, the assumption that the person is okay. The tests work in an interesting way. Usually what you do, you measure antibodies. In this case, you don't measure the antibodies. The test is actually looking for the genome sequence, the genetic sequence of the virus. Into a swab, it can be done on the nose, it can be done on the throat, it can be sputum. So how do we know if the person, is okay? It's because we do two tests. It could be that you still have some viral load in your body because you're fighting the virus, but that's usually, it's not a concern because the person cannot infect other people in that situation. However, I want to say that in the literature, what I saw that in China, they published the early result and they look like that some people, they're infected up to 37 days since they contracted the virus. So which means
37 days, did you say?
Yes. So it actually was published on JAMA. So basically, if I get sick today, for the next 37 days, assuming that I recover, so recover means that I do two tests and I'm okay, up to 37 days, I'm technically infected. No, it doesn't mean that everybody. There are some exceptions. That's the range is from 1 day to 37. Most of the people, they get not infected anymore around day 24. That's from the literature. Again, the data they came very, very quickly from China. I'm a scientist, and there is a process to go to publishing your papers. Yeah, everything was done on steroids. Everything was done very fast and quick. So we were not able to check, but we need to trust, journals like JAMA and New England Journal of Medicine are very important. So I'm assuming they did their homework.
Kara's writing in from Evanston, Illinois, and asking, what does the end of this look like? And what are the metrics that will tell us when it's safe to go back to work or to school, to parks? And she's asking, do we all essentially have to get it and build immunity, or a large percentage of us? And before we have you answer that, Dr. Filardo, Yasmin, let me ask you, what is the federal government working towards? As they think of a question like Kara's asking, what are they trying to move us towards?
Well, obviously, the federal government wants an end to it. The economy's sort of tanked the last couple of weeks. We've had reports of layoffs beginning because businesses like restaurants and stores that have hourly workers have had to close. So there have been layoffs. There have been layoffs in the airline industry. The economy has taken a really hard hit, with the world essentially shutting down for several weeks or a couple months at a time. So the administration's been urging people, like we said earlier, to practice social distancing, to try to mitigate the spread. I think you had said earlier, flatten the curve, try to make sure that there isn't a crush of cases in the healthcare system, so that doctors and nurses don't have to make these really tough decisions, sort of triaging patients and deciding who has the best chance of surviving or, recovering, sort of some of the difficult choices they've had to make in Italy that we've heard about. So I think they're urging these sort of social distancing practices. They're looking at models that help explain how bad it could get, what it could look like, and also looking at models at how much you can slow the spread or reduce the number of cases if you take certain measures.
Yasmin, you've been reporting on the White House reaction. What was it that changed President Trump's comments on this? What was the tipping point for him to go from downplaying the severity of coronavirus to talking about his concerns?
We actually don't know exactly what changed his tune back on Monday. We've been wondering if it was maybe the Imperial College report that showed just how bad this could get, that millions of people could end up dying. We know that from our reporting over the weekend that the president was shown a model showing that this could last a couple of months. And then, we saw on Monday, he said this could go on till July or August. So we're not sure if it was maybe the Imperial College report, if he was shown some other model, if it was a certain advisor sort of, making the case to him in a way that finally resonated with him. But we have seen a pretty distinct change in his tone. There's still a lot of self-praise in these press conferences. There's still a lot of praise over travel restrictions and that sort of thing. But you have seen, sort of a stop to Trump and other administration officials trying to downplay the threat, which, every public health expert we've spoken to and medical expert we've spoken to has said is really important, because people look to those press conferences and to what top administration officials for messaging and to understand what they should be preparing for and what they should be doing. So I think you can probably see that reflected in, how people are behaving now.
So Dr. Filardo, back to our question from Kara, what does the end of this look like?
Well, I'm afraid that it will take a little bit of time. I think that unfortunately, approximately 20% of the population will be getting infected. So we're talking about 360 million people in the country. We're talking about approximately 70 million people getting infected. The end look like, if we do like we were just suggesting now, we're going to be smart in terms of social distance, and personal responsibility and social responsibility. I think that even if we get 20% over time, we will be having a little bit of time to actually develop our own vaccine. And hopefully we will be able to protect the vulnerables so that they can make it without getting infected into next year. More likely, that's completely my estimation, very subjective, based on my own models, which again, I run with data that are not completely checked because I get data from different sources. I'm expecting the number to go very high because now we will be testing. So we'll be testing also people that people are not supposed to be testing, 2 weeks ago. And then will happen that little by little we will see unfortunately mortality going up. Hopefully we're going to have the resources that we have available. If the administration decide to, like you were suggesting, to implement measures immediately to restrain. Our look. The difference between Italy and the US is very simple. If I tell Italians stay home, they live in apartments. They have 4 or 5 people living in a 2-bedroom apartment. They don't have a yard. Here in this country, we're lucky because we have lot of room. So if I ask you to stay home, you stay home. But if you want to take a walk, that's totally fine, because as long as you don't actually interact with other people. So really, what is asked to us is very little. It's just to protect the people that have, unfortunately, a worse outcome if they get infected. So my prediction is number will go up. The infection will be around 20% at the end of this process. And hopefully, before we get to that 20%, we will be able to develop a vaccine probably early next year, so that the people that are more vulnerable are able to receive it. So probably for the next year, we will be still dealing with this virus.
Let's talk about some practical advice for people who do live in close quarters. I'm not talking about people who live among family members, because we can contain that unit, but people who do live in apartment buildings or some sort of shared housing where they're passing by people in common spaces on a regular basis. What should we be doing and not be doing if that's how you live?
So the main transmission of the virus comes from droplets coming. When I speak, I have an accent, so when I speak, I'm very messy. So if I'm infected, I'm a bad person to be around. So stay away from me. I keep at least 6 or 8 feet. For me, maybe 9, because what happens is the particle droplet, they slowly go down, right? But they can also stay in the air for a little bit. There were some analysis done in the study done to assess that. So as long as you're far away, a meter from someone or 1 yard, and you're very careful, if you see the person sneezing or coughing, just try to stay away, you're still fine. But more importantly, what really we haven't done too well in the past, even with influenza, with the flu, it's whenever you go home or whenever, just wash your hand. Don't touch your eyes. Don't touch your nose. Don't touch your mouth, which is thing that we do every day. Think about if you're on a subway in New York, right? You touch and on the railing because you're running, and then maybe you touch your face, but that's normal. We need to be careful now. We cannot do that. So wear your gloves. I mean, even regular gloves for now, it's fine. But clearly, when now we enter, the summertime, the springtime, just wear gloves. Try to be careful. Don't touch your mouth. Don't touch your eyes. That's a very big measure. And wash, surfaces around the house. If when I was working on my PhD, I was living with 4 other people coming from all over the world, and so we were very careful about how we were cleaning up the house. Do it, use Clorox. That's fine, even if your nails they get funny, that's fine for a little bit. so there are very simple measures that are all what I call epidemiology 101 against epidemics is wash your hand, wash things that you actually share with other people, keep the distance, and hopefully soon we will be able to test all of us. It will be nice to know if you're a person at risk or not. When we were talking about Hong Kong, Singapore, Taiwan, I love this country because their public health officials, they were very quick about acting. They act very quickly. In Hong Kong, they're still doing it. There is a questionnaire that every single person needs to fill out every day. There is written your temperature, do you have any symptom, and every week you need to report. If you get to a point that you can score it, see that you're technically at risk, immediately you call your doctor, you go to get tested. If you do that, it's not very difficult, it's very simple stuff. We can actually really identify the people that are at higher risk. Again, sure.
Oh, yeah, Yasmin, I mean, so who is taking the responsibility there? Let's talk about the local responsibility and response of government's statewide response versus federal response. We have our Governor Cuomo of New York trying to praise President Trump and vice versa, trying to have like more of a collegial relationship and work together. But where are we seeing leadership come from? And what is the White House saying states and localities should do?
Well, states are on the front lines of this. So closing schools, closing restaurants and bars, limiting social gatherings, those are state decisions. The federal government can't, dictate to them what to do. They can issue guidelines, but it's ultimately up to states and cities to decide what measures they want to take and how drastic. But obviously the federal guidance makes a big difference in what they decide to do. You did see states like New York, California, Washington sort of out ahead of the federal government, when they were having these large outbreaks beginning and starting to see community spread, that they moved more quickly than the federal government to, start urging people to limit social gatherings. You've seen the Bay Area take some pretty drastic measures since they're having a lot of cases there. So the federal government can issue guidelines. Really drastic action would be issuing a sort of quarantine for people and limiting how much you go out, like we've seen in other countries. I don't think those are extremely serious discussions right now. So what we're seeing right now, school closures and things like that, those are state and local decisions.
Here's a question that gets back to the practical heart of this, asking about viruses on surfaces. Just how long does a virus live on a surface? That comes from Oklahoma. Dr. Falardo, can you give us a sense of that? What do we know?
Yes, I do. Again, with another new paper just published a couple of days ago. It really depends on the surface. It looks like that's a metal, like aluminum or glass. The virus actually likes it, that particular material, and they can be surviving for a few days. The virus doesn't like cardboard for some reason, probably because it's very porous, so somehow it doesn't work. And what they found, again, that we were not really aware of, it looked like the virus can actually float in the air for a little bit, which initially we didn't believe that, but now there are some tests showing that. One thing that we want to keep in mind, even if the virus is, let's say, on a glass or somewhere, and it can stay there, up to 4 or 5 days, whatever. I think that pretty much the timing. The viral load decreases over time, which means that if I'm going to be in touch or in contact with a particular virus that has been there, let's say, for 3 days, I have certain probability to get infected. If I'm going to be touching the virus, touching my mouth or my nose, etc., after 6 days, the probability is way, way lower. So that's why, again, you go back again to this basic stuff, social responsibility. If I have symptoms, like, for example, I have allergy. Right now, I don't know if my cough is allergy or if it's the virus, right? So what I do every time I touch something, I just tissue, throw it away. If I touch my glasses, I clean up. So it's very, very important that we do what, we need to do to, the assumption is that always assume the worst case scenario. So be careful and make sure that you try not to infect anybody else. So virus, unfortunately, can survive a few days on certain surfaces. In other surfaces like cardboard is not a problem. When you go to the grocery store, most of the stuff is just like, it's safe, 99.999%, so I'm not concerned about doing that. So yes, that's pretty much what we know right now.
When you mentioned flattening the curve and when we talk about flattening the curve, and Dr. Falardo, you were talking about why that's significant. One thing that we've heard about from health experts, as well as some state officials and federal officials as well, Yasmin, is that a big purpose to flatten the curve is to space out how many people would be at a hospital at one time, because resources are so tight, which is, of course, a very disturbing proposition. So I want to go over this question from Elaine, who wrote to us and asked, what is being done to acquire more ventilators for U.S. hospitals? And while we answer that, I want to welcome Mike DeBonis to the conversation. If you saw a new face come in, he's our congressional reporter joining us live from Capitol Hill. Mike, thanks for being with us. We'll get to you in just a moment, but I want to go over this question about ventilators and what's being done to get more. First of all, why is there such a concern over supply? And not just ventilators, but all hospital equipment. Yasmin, can you talk to us briefly before we go to Dr. Falardo about what the federal government has to say about the scarcity of these things?
So, they have acknowledged that there are shortages of critical supplies like masks, like the nasal swabs that you need to conduct the diagnostic tests. The question of ventilators has been a little bit harder to get a straight answer. But President Trump yesterday said he was invoking the Defense Production Act. He didn't really specify how he was going to use it or what it was going to mean. But what we do know is it allows the federal government to sort of ramp up production of things like medical devices or other sort of industrial equipment that might be needed. It's still unclear how it's going to work. He said we're not going to use it unless it's an emergency and we really need it, and hopefully we won't ever get there. So it's a bit unclear what exactly is being done to address the issue of ventilators. A lot of our stories have just focused on concerns in hospitals and healthcare centers about masks and equipment and things like that. But maybe Dr. Falardo knows more than I do about, what exactly can be done.
Dr. Falardo, why don't you jump in?
Well, yeah, the issue is that we are not, the society is not organized in a way that we are prepared for this kind of clearly very, very rare physical circumstances like a pandemic. Hospitals, they have only a limited number of ICUs and therefore ventilators. When there is a situation where you are requesting basically 30 or 40% more than whatever is available right now, clearly the hospitals, they cannot handle. So that's what happened in Italy.
Dr. Falardo, I wanted to interrupt you for 1 second. Mike DeBonis, if you can hear me, we're going on a wild adventure with you around the Capitol.
Sorry.
So that's okay. You are on though. So even though you're not talking yet, we do see.
Oh, sorry.
That's okay. You've given us a tour of the Capitol, and I have many questions for you about just where you are and what you're doing. But I want to get back to the heart of this, because this is such an anxiety point for so many people, especially if you have an elderly relative or someone who might have a lung issue. The prospect of not having a ventilator when it's needed is so scary. So, Dr. Falardo, can you pick up back on that?
Yeah, it does go back to what happened in Singapore, and Taiwan, and in Hong Kong. They were prepared. So they did something that is called, health resources assessment before. As soon as the China government told them to the world that we had a problem with the virus, first thing they did, let's check what we have. I'm an epidemiologist. First thing I do, I check, I get the information. So they assessed what they had in place. Here we really can't, because our health system is very, I would say, discombobulated, because there are a lot of hospital settings. There are a lot of, it's very complicated here for the government to understand how many hospital beds we have in terms of ICU. There is an association called the American Hospital Association that actually can provide a lot of help about that, guidance, saying knowing where the ICU are, and knowing how, for example, in Italy, what they're doing now, they're moving patients that are in ICU from certain region to other regions because they have more availability in other regions. So here, first thing to do is to assess how many ICU we have, how many ventilators we have, try to estimate how many people possibly we are going to get. In places like New York, where you're probably going to get a lot of cases, probably the shorter of the ICU will be very, very, very high. I really appreciate what Governor Cuomo did to think ahead. It's all about now we are here, what we do to fix it. So he assessed, we don't have enough beds. Okay, let's ask the president to help us out. And it probably, going back to what you were saying, and that's probably, we need a quarterback. We need someone that tells all the players what to do, or call the shot. And here you look like that they're on the process of getting there, and all the pieces are almost there, but they're not there yet. But hopefully it will happen soon.
One question that did come in on this point, I just want to get to real quick, this question of hospitals and supplies. We've been seeing reports in the Washington Post and other places about hospital staff trying to use, goggles and makeshift things and bandanas to protect themselves. So how protective is that sort of material? And Dr. Falardo, obviously me walking down the street is different than an ER nurse and what he would be coping with.
I would be more concerned actually about their exposure to people because they might be infected and be at that point carrier. And they are, as you know, one of the main reasons why you're wearing the mask is to protect other people against you. And having a bandana doesn't work. So this morning, a pneumologist, a friend of mine from Florida, told me that one of his patients tested positive, immediately self-quarantined himself. So what I'm saying here is it's, again, go back to the social responsibility, personal responsibility, what we do. So if I'm a clinician or someone working in a hospital environment and I'm in daily contact with patients and I don't have the appropriate gears to do my work, I raise my hand and say, I cannot do it. I need to have what I need, otherwise it can be dangerous for other people.
Let's bring Mike DeBonis into the conversation. So Mike, first of all, tell us where you are in the Capitol right now. Where are you at?
I am on the Senate side, about 20 or 30 yards away from the floor, in a quiet hallway, a much quieter hallway than usual.
What are people doing there? We've seen reports now of a couple of House members testing positive for coronavirus. What are you doing to protect yourself? What is congressional leadership doing to protect its members?
So, number one, the House is not in the Capitol this week. The House members left after votes early on Saturday morning to pass the relief bill that the president signed into law yesterday. The Senate is here. They are working. They have taken some precautions. They are doing some sort of social distancing. They've been meeting in larger rooms to sort of separate themselves from one another, but they're continuing to meet. The staffers are working much as they have been previously. I think some sort of in-person meetings are obviously being replaced by phone calls and other, telephonic sorts of media. So, but people are still here. They're still working. I mean, and reporters are still on top of each other. To be perfectly honest, we're being a little more, certainly more mindful of everybody's personal space, including the personal space of the lawmakers. But we're still here in person. We're still in proximity to one another. So it's not an ideal situation by any means.
Jack writes in and asks on YouTube, can Congress work from home somehow? And then what will happen if the virus does indeed spread through the US government, Mike?
Well, I mean, we're starting to have that conversation now because we had two members say that they were positive for COVID-19 yesterday, two House members. They're now self-quarantining at their homes, one here in DC, a Florida member, and one who's in Utah now. But there's also a sort of cascading number of lawmakers who were in proximity to these people last week who are now self-quarantining, even though they're not symptomatic. But so it's something that everyone is now thinking about. There's discussions about remote voting. Today, the chairman of the House Rules Committee said he was looking at proposals to do remote voting. It's unclear whether that's going to go anywhere, but it's at least a discussion that's happening right now.
Washington Post reported this afternoon that the head of the Senate Intelligence Committee, Richard Burr, was at this private lunch 3 weeks ago, and he warned the people that he was with that coronavirus could be a huge deal. Now, this was a recording that NPR got a hold of. He compared it to the 1918 flu epidemic and said things privately that he was not saying publicly. Mike, take us through that story and what the present fallout is from that.
I mean, you pretty much said it all there, Libby. I mean, the basic story is that he was saying something privately that leaders of his party were not saying publicly, particularly President Trump. I don't think anyone asked Richard Burr about it in that time frame publicly, any member of the press. I don't think we can point to something where he personally said something differently, but it did go against the message that the president was sending at the time, which was this too shall pass. He was certainly not putting out alarm bells of the kind that Richard Burr was telling his fellow North Carolinians in this private event.
Yasmin, can you jump in and remind us what the president and White House staff was saying 3 weeks ago?
3 weeks ago.
Well, it was various, levels of, minimizing the situation. The president saying, well, even if it comes, it'll be, when it gets warm out, it'll go away. Like it could be big, but might not. It seemed like at the time he was more mindful of preventing what he perceived as an overreaction in the markets than he was.
Let's have Yasmin jump in on this. Yasmin, 3 weeks feels like 100 years ago in terms of how we've all curbed our activities and how much our lives have changed, especially if you've lost your job or lost your source of income or you have a family member who's sick. But take us back more to what the White House was doing just a couple of weeks ago.
Yeah, I was trying to remember what was 3 weeks ago, but I think that was right around when the president put Vice President Pence in charge of the response. And that was actually because Nancy Messonnier, a top official at the CDC, had done this call at the end of February where she said she sat her family down and warned of significant changes to daily life, and they had to be prepared for that. And at that case, the US had around a dozen or 15 confirmed cases. but those were just confirmed cases. There was pretty limited testing going on at that time. And now, the thought is a lot of the cases weren't being caught because the criteria was so narrow. So, the White House actually grew extremely frustrated with Nancy Messonnier's comments and thought it was a huge overreaction, and why would she cause that type of fear? And we sort of see that that's exactly what's playing out now. Now people say she was right, she was just a couple of days too early, but that's still, even in that press conference where the president announced that Pence would be running the response, he reiterated over and over, we only have 15 cases, and I think it could be down to 0 pretty soon. Even though that ended up being the same day that we learned of the first community transmission case. So just 3 weeks ago, the president was saying, soon we'll be down to just a couple of cases or 0 cases, and it'll sort of miraculously disappear. So obviously we've come a long way since then.
Mike, what has Congress done so far? What are they considering doing next?
So as I mentioned, the president signed into law a sort of interim rescue package that was aimed at providing some sick leave, some family leave for people who've been affected by this, either directly or indirectly because they need to get tested or they've had loved ones that need to get tested. That bill also looked at a number of other things, free testing, a few other things here and there, but the big deal is still ahead of us, which is a economic rescue bill that, by all accounts, is going to be $1 trillion plus to inject some cash into individuals and to businesses that are basically hanging by a string right now, that the economy has basically been shut to ground to a halt. So today we expect Senate Majority Leader Mitch McConnell to come forth with a proposal that the thinking is that starts a negotiation with Senate Democrats, with House Speaker Nancy Pelosi and her chamber. This could stretch out for the next, certainly 3 days at a minimum, maybe, this time next week, we could still be talking about this. But there is obviously a lot of urgency just because of the scope of the situation that the country and the world is facing, but also because you've got senators here who aren't going to leave until this is done. And trust me, they want to leave and sort of follow the best practices that everyone is being told as soon as possible. And that goes for, I will say, for reporters and staff too, who, we're showing up here every day while I know you guys are sitting at home. And it's not an ideal situation, as I said before.
Yes, and there's also been some criticism of the White House team that comes out and does the briefing, the coronavirus task force, because they come out and stand really close to each other and they share a microphone, and there's a lot of touching and sharing of germs that we've all been told not to do. I will point out that Terry, who's joining us on YouTube, said, there's no reason why Congress can't do Zoom sessions, sort of like what we're doing right now. So a big question about is Congress going to sort of have to come into a new mode and a new way of communication. I have another serious question I want to throw in here that's coming in about medical issues. Dr. Falardo, we know that the elderly are at risk. We know that people who have pre-existing conditions are at risk. I want you to review for us, though, Doctor, what pre-existing conditions might be especially vulnerable. And then also we are seeing data that the very young can also be at risk. So we're talking infants and children under 5. Can you take us through those groups, please?
Yes, the people that have underlying condition like heart disease or lung disease, also people that have hypertension, people that have diabetes.
I'm sorry, hypertension is quite widespread in America, so that's important to point out.
Yes, all these conditions, they compound one above each other. And clearly age is a kind of a proxy of all these conditions. So older you are, more likely you are to have the heart disease, more likely you are to have COPD, more likely to have diabetes. So all these conditions, they, like I said previously, they really put you in a situation where if you actually get infected, the body starts to respond to the infection. Unfortunately, the response is with high inflammation within the organism. And each organ starts to overreact to the virus. So that's the main condition. But what you look like for the data that we have available now, the key age because the immune system at that point for the elderly, given all the information that I just provide to you, really puts them at very, very high risk. This process probably, we don't know how bad it is, but we know what we see, unfortunately, which is mortality, ICU, etc., etc. For children, it's going to be strange because thank God it's just very their mortality or their risk of becoming seriously ill is very low. There was a Chinese study published last week showing that basically that very little percentage of children that are really high risk of getting very, very ill. And what we believe, and that's just an hypothesis, that's because children, especially when they're very, 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 very young, between 0 days, 1 year old, they get some immunity from the mom and from the mother, and at the same time they're building their own immunity. Probably the two process together, they actually result in better situation for the children. Another hypothesis was that, especially for China, where there is very, very high pollution, means the baby have not been exposed to pollution yet, so the lungs are still kind of working nicely and they're developing. So they are more able to respond to the virus, given it is a respiratory virus. That's what we know. Now, unfortunately, as I said, data they're not being really confirmed. The publication process now is not the normal standard publication process. That people submit the paper, very quickly we review and send it back. Usually doesn't work in this way. Usually it takes 6 months to publish a paper. so now it looks like it's good news. But importantly, like I said earlier, everybody has the same probability to get infected. The difference is that children are less likely to become seriously ill.
All right, thank you. Hey, Mike, I want to let you go because you probably have more reporting to go do. Any final thoughts you want to leave us with?
Nope. Interesting times ahead. Thanks for bringing all of us together.
Hey, go wash your hands, okay? Thank you. Thank you, Mike DeBonis, our congressional reporter. I want to bring into the conversation Mary Beth Albright. She's one of our colleagues at the Washington Post. She's our food anchor, and she also has a background in public policy. So Mary Beth, thank you so much for joining us from your home. You've provided some comfort programming for me as I've watched your videos about practical things like what we should have on hand during this time. So I'd just like to bring you into the conversation here. To have you tell us about what are some of these foods and items and staples that we really should have on hand, because we're all trying to limit our shopping trips and be as efficient as possible when we do leave the house or when we have something delivered.
Thank you so much, Libby. This is the most serious time, right? I can't think of a more serious time in public health in the decades that I've been in public health. And I think bringing that into it is so important because we want to have deliciousness. We want to have joy in our lives, but we also need to take care of ourselves. And one of the ways that we can is with small, simple projects. Because when you're at home, my kid is upstairs doing online school, the dog still has to be walked, but you need to take care of yourself in times like this. So what I focus on with the foods that I recommend is eating for your mental health. I have no idea how many calories I eat a day, but I know the foods that scientifically there are studies that I go into because of my background in public health that tell what's going to make you feel better and bring a little bit of joy in your life. So some of the things I recommend: whole grains, beans. I've never seen Americans so excited to eat vegetables. Like the vegetables are just gone from the shelves, frozen vegetables, fresh vegetables. But that is terrific. Frozen fruits or even freeze-dried fruits are fantastic. And all of these things have been shown to reduce or mitigate anxiety. And I think those are really important. We're doing a quarantine cooking show, which we just shot the 3rd episode today, and we're doing a happy hour. I'm just going to stop there. It's not an in-person happy hour, but I think there are a lot of things you can do. I mean, we have the spring equinox coming up. We have Passover. We have Easter. And these are holidays or dates that celebrate food among people. I mean, if you want, I don't like the word control, but I like the word power. And we have power to bring our tribes together, even if they're all over the world. And I think that's the kinds of things that we should be doing right now.
It's just important to hear and remember, Mary Beth. You had raised a great question with me that I want to throw to Dr. Filardo. We're all being encouraged to support our local businesses, and we all want to do that. Takeout, getting food delivered is a way to do that, making sure you don't actually interface with another human being, but purchasing some food. What about the potential for contamination if someone's sick and working as like a delivery person? Or what are the hygienic things that you recommend that we all do to make sure that viruses aren't spread in other ways besides that person-to-person contact?
Well, the issue is there is a famous restaurant, I believe in New York, called Carboni's or Carboni, I don't know. And I was reading the news probably yesterday. There was a huge line outside of all delivery people. So all these delivery people, they're all in very, one attached to each other. So there is no self-distance, there is not the 1 meter. So the problem is they might get infected and infect each other. They might come to your home, and they might infect you when they give you the bag with the food. I'm not concerned about the food. I'm not concerned about the way that's what's into the box. I'm more concerned about the carriers and also the health of these people that unfortunately they are there outside, dealing with the whole process.
Right, we don't want them to be put at risk,
Right.
even though they're trying to make money, of course. So I guess that's the question of messaging, Yasmin, and how the government is able to get the message to everyone, including people who still need to be working right now. And thank goodness for them, for the rest of us, people who still need to be interfacing with others. And so what are you going to be watching for, Yasmin, in terms of getting the message out, not just giving the guidance from the federal government, but getting that to people all over the country in all languages, in all communities?
That's a really good question. I think with the White House taking over the response a few weeks ago, a big focus was making sure that the government spoke with one voice, that people didn't contradict each other, that the guidelines and the message that they were sending to the American people was consistent. That hasn't quite happened. But I think what we'll look to see for is, if they start to sort of be more consistent in the briefings, in the press briefing today, it was a bit all over the place. You see that they sort of careen sometimes and sort of veer off topic. And I think that can make people sort of confused and not know exactly what to listen for. So I think what we should look for is to see, and not just the press briefings, but, a lot of these officials like Dr. Fauci from the NIH, Dr. Birx, other public health officials are going out there and doing a ton of media interviews on cable networks and, trying to reach as many people as possible. So trying to see if they, and so far the medical and health professionals pretty much have, speak with one voice across those platforms, go out and try to reach people where they are. Not everyone is going to watch the daily White House briefings. People are more likely to see people pop up on cable news and various channels. So just seeing, how they're using that time on air to sort of talk about the administration's response, how bad it could get, what they're looking for, and what they want people to be doing.
I just want to throw something in, like the parents of kids get a lot of different messages, right? So there's the don't gather more than 10 people in one place. And then there's also, I received because of my public health background, I received an email from the executive director of a major hospital saying, don't put your kids together under any circumstances. No play dates, no sleepovers. My son turns 12 next week and I got nothing, And so there are those, because we obviously don't want to expose our children, but we also want them to exercise in a world where today Little League canceled the season until at least middle of May. So, 12-year-olds need play.
Dr. Filardo, what's your impression of that guidance to not do any play dates? Because that's what I've been told as well. Certainly, no.
Totally agree. Simple. Again, children, like we said, likely they are less likely to develop symptoms. They're less likely to to go into the very acute phase of the infection. Therefore, they might be carrier without knowing it. So if you do a play date with a friend of a friend, if one of them is infected, then the baby can, the child come back home, it's going to infect all of you guys. And then again, do not go to visit your parents. Make sure that elderly, they are very, very nicely protected in their own place with limited opportunity for them to get infected by others. We can all go back to normal life as soon as this thing is almost over. So we just need to be patient. If we do that all together, we are going to be just fine.
Also, a point you made about metal surfaces. So many playgrounds are metal surfaces. And so that's not advisable to bring your kids to play, because it's impossible to get small children to not interact with each other if they're around each other. I want to throw one more question out to the group. Mary Beth, Quina wrote from Olympia, Washington, and asked, how do I mentally and physically prepare for a quarantine? What are your thoughts, Mary Beth?
I remember back in law school in the early 2000s, I was taking a public health ethics course, and my professor said, look, the world is overdue for a pandemic. He's not doing well. So, it's hard to plan for these things. As I said, make sure you have foods that are going to make you feel good, not just in the moment, but long term. Everybody wants to dive into a bag of potato chips. I totally get it. But if you watch the video on the 10 foods to keep in your pantry, and you keep cooking in simple ways, remember, simple projects, I think that'll help a lot.
I want to thank all of you so much for being with us. Mary Beth, let's do a Zoom for your son to wish him a happy birthday next week. And,
I would love that. He's literally sitting across from me, and when there was somebody said no play dates, he's like so exasperated,
Awesome.
Yeah, there he is. He's exasperated.
We feel your pain. We all feel your pain.
We got to figure something out, definitely.
I want to thank you, Mary Beth Albright, Yasmin Abtalib, and we've also got Dr. Giovanni Filardo joining us from Texas, an epidemiologist. I want to end on this picture of Mary Beth's dog, who made a very poor choice in not only destroying something, but destroying something incredibly valuable. So
I have a puppy who loves to chew up toilet paper, and
toilet paper safe.
Huge mega rolls are just gone, so
keep the toilet paper safe.
But it is what it is. Stay with the joy as much as you can.
All right. Well, thanks so much to all of you. And thank you for watching our live stream. We're going to continue taking your questions, and the Washington Post is answering questions in a variety of ways. We're doing it on, this video chat. We're doing it in audio form. We're also doing it, of course, on our Washington Post website in the written content. So subscribe, join us to get your questions answered, and we'll continue this conversation. I'm Libby Casey, and I want to thank all of you, and also thank my family for staying amazingly quiet for the past year.
Unlike mine.
And thanks to all of you, Yasmin and Dr. Filardo, for joining us and taking time out of your days. Thank you so much. We'll see y'all later.
Bye.
Thank you. Bye.